I'm Dr. Paul Kamfwa, the gynecologic oncologist based at Cancer Diseases Hospital. Apparently, Cancer Diseases Hospital is the only hospital here in Zambia which caters for all the cancer patients.
Currently in Zambia, we only have 6 trained oncologists, and these are clinical oncologists, and all of them were trained from outside. We do not have a gynecologist, neither a surgical oncologist.
But Merck Foundation had to collaborate with the Ministry of Health, and they had to identify me so that I could go to India and study at one of the world-class centers in India which deals in cancer. And this is Tata Memorial Hospital in Mumbai. Apparently, I'm the first Zambian gynecologist who has been trained as a gyne-oncologist.
So my full names are Dr. Murindwa Makasa Justin, consultant under the Pediatric Oncology Unit at the Cancer Diseases Hospital here in Zambia, which is the only pediatric oncology care center in the whole country of an estimated 17 million Zambian. The pediatric unit at this cancer hospital attends to about 120 to 150 children with cancer every year. They have to travel over about 1,000 kilometers to get to this one center to access this treatment. And in an analysis that was done in the last 4 to 5 years, it was shown from there that the abandonment rate of treatment is about 50%, with only about 8% of them really completing therapy.
I was very happy to be trained at Tata Memorial Hospital. The reason being is that there is a huge volume in as far as the patients are concerned, such that if you look at the learning curve, it's very excellent. One can get to grasp the skills within a very good time, especially looking at the number of the patients that they see.
Because this is the only cancer treating center for children, we tend to see a lot of late stage disease presentation. So the big question there is what you do with those patients that have presented late. So one key thing that is useful that I learned during the training program is the use of metronomic therapy, okay, which is consistent administration of small doses of chemotherapy to these patients that will relieve their suffering.
In addition, what I learned was management of these patients comprehensively is supposed to be done by a multidisciplinary team. You have good radiologists and interventional radiologists, whom we don't have currently. You have medical oncologists, you have radiation oncologists, you have palliative care team, you have the pathology. All these, when you put them together, they actually form a very good team to give a best treatment for cancer patients. So to me, going to an environment with such human resource, I thought was very, very, very profound.
My training has brought a lot of changes to the country, especially for the past 6 months when I came. In that we have got a reduction in the number of referrals that we were sending out, because most of those patients, I operate on them together with 2 of my colleagues.
So the impact is almost immediate and instantaneous, as you can tell, from perspective of patient care. Okay, so definitely there will be improved pediatric oncology patient care, education of the undergraduate medical students, as well as the postgraduate general pediatric residents will also benefit in their training as a result of my pediatric oncology training. Also, collaborative efforts with other centers from around the world.
Having stepped into being one of the first person to be trained in Zambia under the Ministry of Health to go and get a surgical oncology training, I should say that we have a lot of people actually wanting to do this training in the various field of surgical oncology. I think it's important and it's going to bring a meaningful change in terms of better healthcare provision in Zambia.
I've suggested that this is a very good training to my colleagues, and for your knowledge, in a month's time, there is another gynecologist who is going to go to India at Tata Memorial Hospital under the auspices of Merck Foundation. He's going to do the same Merck Africa Oncology Fellowship. He has been identified by the Ministry of Health, and we are happy because that will make the two of us.
Very thankful to have had this great opportunity under the Merck Africa Oncology Fellowship Program to go and do pediatric medical oncology at a world-class center of oncology care in Tata Memorial Hospital in Mumbai, India. This indeed, as I have shared before, is of great benefit to myself, my patients, and my country. Thank you very much, Merck Foundation, for this great opportunity afforded to me and my colleagues.
You may be aware that some of these trainings or fellowship programs are actually difficult to come by. What Merck did was a tremendous work, and indeed a pat on their back, and I hope they can continue to offer such programs to especially countries like Zambia, where we are still trying to be better in the providing of our healthcare services. Indeed, to Merck Foundation and the entire team, say thank you very much for the great opportunity, and I think we can see light at the end of the tunnel.